We have pyramidal system, we have extrapyramidal system, we have cerebellum with its connections. Now, if you look at the books on the shelves somewhere in the shops, you will find that most of the scientists, they are talking about movement and movement disorders, and they emphasize that this is the problem with pyramidal, extrapyramidal, and cerebellum also. Because all our pathways, they are situated all close together, and all our movements, they are coordinated by function of pyramidal, because it's alpha motor neurons, which has to contract the muscle. It's extrapyramidal, I will explain you for what reason, and it's cerebellum with its connections to first sensate intrafusal, yeah, then extrafusal, and then contraction together. So extrapyramidal system was developed for, first it has two parts. It has old part, Pallidum, and new part, Striatum. So the Pallidum is old, Striatum is new. And the old part, Pallidum, birds, they also had Pallidum because it was developed for simple tasks. Just simple tasks. Construction, movement. Okay? Simple, which minimize our energy. And our brain is developed that way that any movement which has to be done will be done in a quick way with minimal energy. So if we can, for example, take this shit, I will not do it like this. I will just go straight and take it. If you take the teapot, for example, it's hot. You will just it's hot, and you will just take the hand away. You will not do something like this. This is Pallidum for all simple tasks which economize our energy. Simple, very simple movements. But we are different than the birds and so on, yes? Why? Because we can do more, very more. And we can paint, we can play on our musical instruments. So we can do some tasks which are difficult to perform if we just only have Pallidum. That's why we have in the brain striatum. This structure is for doing very interesting, very significant, and very hard movements. This is striatum. So, if we have problems, and so if we talk about extrapyramidal system, we are talking about gray matter in the brain, in our brain, and there are nucleus, yes? Nucleus of gray matter. This we call extrapyramidal system. Corpus striatum, Pallidum, it's a lot of nucleus of gray matter. Yeah? Thalamus, the same as it's also included in extrapyramidal system. So what you have to know and what you have to remember. First, you have to know all the nucleus. Which nucleus are Pallidum and which of them are striatum. You just have to remember it at home. Anyway, you have to know it to your exams. What we have to discuss that if we have problems with our Pallidum system, all our movements will be very, very simple and very, very minimal. For example, Parkinson's disease. The patient is hypermimic, no mimics. He doesn't laugh, he doesn't smile, he always looks sad, because no mimics. Mimics, it's also striatum. We laugh, we cry, we can be sad, we can smile. This is striatum. So we have problems with Pallidum, and the patient is hypermimic. He moves slowly, he looks sad. And very important thing is for this patient that his muscle tone is increased, but not like spasticity. Spasticity is the pyramidal tract, like plasticity. Plasticity means increased muscle tone, but in any movement. So if we talking about spasticity, we were talking like this. It's difficult to do, then we can do it. Difficult to do, then we can do it. Plasticity, plastic tone, means we can't do it like this, like this, like this, like this. So this, the patient, is hyperkinesis because it's difficult for him to make any movement of his increased muscle tone. Other way we call it akinetics, hyperkinetics, rigidity syndrome. Rigidity means muscle plasticity, rigidity. Akinetica, rigidity syndrome. Akinetica because he's hypermimic, he moves slowly and makes very slow, minimal movements. Sometimes in these patients, they have another symptoms called propulsions or retropulsions. This means that to initiate movement, he needs time. It's very difficult for him to start doing something. He stands, he tries to begin to walk, but then he feels like somebody knocked him back, and he begins to move, and he can't stop. Okay? And the same way to back, retropulsion. And always they fall down because they can't stop quickly. For this to stop, we need striatum, and we need very serious connections between pallidum and striatum. If we have dysfunction in striatum system, we have another kind of symptoms. I said that this system we need to do very interesting movements. So if we have this part of our brain affected, we will have hyperfunction, hyperkinesis. Hyperkinesis means more, not important, very aggressive tasks which the patient will do and he can't stop to do this. His hand will, for example, for loose body, if loose body is affected, the patient will make this movement and he can't stop it. This is called hemipallism. He can't do it. He can't stop it. He doesn't need this movement, but he will do it many, many times a day. Sometimes he will have, for example, the other one, hyperkinesis with his mimic muscles, and he will sit in front of you, you will talk with him, and he will do like this. And he can't stop it. This is hyperkinesis. Okay? So you see the difference, pallidum and striatum. These things that you have to just to realize and you have to remember. This is the difference. Okay? Then I will show you here for extrapyramidal system.